Certainly. I think that 20 years ago, if you were talking about immunotherapy for cancer, I think you were talking about something that was relatively in the realm of science fiction, or was researchers doing work that wasn't considered part of the standard of care, or even remotely close to the standard of care for patients with cancer. I think that's changing dramatically, which jives nicely with what we're really interested in Penn-Medicine and at the Penn-Mesothelioma and Pleural program. Many of the experimental approaches that we're taking to treat patients with mesothelioma have to do with different ways of activating the patient's own immune system to recognize, attack, fight, and we hope destroy their cancers. So we have, along with many other people, the concept that cancer cells look differently to the immune system than normal cells of the body, that they have proteins on their surface which distinguish them from normal cells, and that the immune system, the white blood cells of the body, have the capacity to recognize these abnormal proteins. But for some reason, cancers have suppressed these reactions that your immune system would normally have against the cancers, and so the cancer is able to grow. Our goal of many of our experimental therapies, including the photodynamic therapy, is to try to find ways to evade the cancers, to make the cancers more recognizable to the immune system so that the immune therapies can work together with chemotherapy, radiation therapy, and surgery to give longer lasting benefit to patients, and we hope longer survivals and better quality of life. So the idea is to try to approach this from multiple different directions, both to activate cells to fight the cancer, as well as to get within the cancer itself to try to make the cancer itself less immunosuppressive. And we have several clinical trials ongoing at Penn right now looking at this. And I'm going to put the question to Dr. Alley. Tell us a little bit about some of the clinical trials for immunotherapy that we have going on right now that are most exciting to you.